For more on that decision and accounting for the confident talk in terms of stepping before the public, we call on Tevi Troy, the president of the American Health Policy Institute and former deputy secretary of the U.S. Department of Health and Human Services. Tevi, once again, we thank you for Skyping in from Washington, D.C. to America's Forum.
Thanks for having me.
Tevi, I don't know so much if it's a delicate balance, but it would seem in public health, and I'm not saying that people are being counterfactual or not telling us the truth, but publicly very confident, very calm, kind of a scientific approach to rhetoric, if you will.
Sure.
But to the layman, Tevi, the CDC raising this to the highest level in terms of an alert, that's a pretty huge red flag. Break it down for us. What exactly does it mean?
Yeah, well, I'm no longer in those rooms where they make those decisions, but I can tell you this, that they think very carefully about the messages they put out to the public, and they tailor those messages to get the reactions they want. So one thing you want to avoid in public health is panic. Panic is a very bad thing, and one of the things that panic leads to is the phenomenon known as the worried well. People run to the emergency rooms thinking they have the symptoms. It's like those medical students in the first year who think they have the symptoms of every disease they learn about. And you saw this a little bit in New York where 6 people went and were tested for Ebola. None of them had it. And so if you overwhelm the emergency rooms with people who don't have the condition, that's a problem. At the same time, they do want people to take careful steps. So you might want to think twice about that trip to Africa that you were thinking of taking right now, especially to Western Africa. If you are in contact with someone who had the disease, you may want to think a little more carefully about A, your interaction with that person, and B, whether you go to public health officials afterwards. So they're trying to ratchet up the level of concern without leading to the level of panic. So it's a carefully tailored message.
Tevi, you prefaced your remarks saying you're no longer in the room when they make those decisions, but the effects of those decisions. What does the CDC and our entire government do differently when you move the alert to this level?
Yeah, that's a really good question. There are a bunch of public health policy steps that take place. You've got the Public Health Service goes on high alert. You've got more careful watching of airports and travel into the U.S. You notify hospitals about these potential problems and tell them what to look for and what to and when to notify Washington or Atlanta in the case of the CDC when something like this happens. You know, we have entire quarantine areas in American airports. So, for example, I've toured the U.S. airports, and there are whole sections that just can be cordoned off with these hermetically sealed, and the people who come in from a plane from an area where there is some kind of outbreak can be quarantined for a period of time until we determine it's safe. So there's a whole bunch of steps that public health policy workers look at a little more carefully when these alert levels go up.
I can tell you, Tevi, when we heard about this in our newsroom, that there were going to be quarantine areas in airports, I don't want to say that those of us covering this story became the worried well that you mentioned earlier, but what about the notion, these reports that, yes, there are quarantine areas now in some of the airports? Does that add to the challenge of the worried well, or can it have another effect to reassure the public?
Yeah, let me clarify this a little bit. There are always these quarantine capabilities at every major airport, especially international airports. There are doors that can be sealed at any time. None of them have gone into effect. So I, for example, toured the SeaTac airport, which takes a lot of Asian travel into the U.S., and I saw the room that can be quarantined. Usually, it's just a regular terminal. So I wouldn't say that there are quarantine areas in effect. I would say that we have quarantine capabilities at all times, and when something bad happens, and we haven't reached that level yet, they can be used.
Well, thanks very much for the clarification, because it is important to understand that difference. And after all, you've been a part of this, been there, done that, as we say, you in your role as Undersecretary or Deputy Secretary at Health and Human Services. Meantime, at the Center for Disease Control, the CDC, Dr. Frieden, leading that organization, did say he was confident that Ebola can be controlled. In fact, he tweeted this out, quote, "We know how to stop Ebola from spreading with basic epi and response. Find disease, isolate patients, trace and monitor contacts, and stop exposure." Tevi, to laymen, that sounds simple. Is it that simple?
I wouldn't say it's simple, but it's very doable here in the United States, where we have good infection controls, where we have a high ratio of doctors and public health workers to the population, and where we have, at this point, a low incidence of the disease. In Africa, it's not nearly as simple. You don't have these good public health measures. You don't have a lot of doctors and public health professionals. I was just reading that in one of the affected countries, they had one lone virologist, and that person succumbed to the disease. So I wouldn't say it's simple, but it is definitely doable in an advanced nation like the U.S.
Tevi, according to an article appearing in USA Today, the number of suspected and confirmed cases in the West African nations of Liberia, Sierra Leone, Guinea, and Nigeria stands at 1,711, including 932 deaths, and that is only since March. So it sounds like those numbers are dramatic to where the disease has gone, and at the same time, I see the headline. We have it up on our screen, Tevi, a screen grab from the USA Today website with the headline, CDC issues highest level alert for Ebola. Again, over at CDC, Frieden says that Ebola poses little threat to the U.S. Do you agree with Mr. Frieden's assessment?
Yeah, at this point, and the truth is that those numbers, while every death is a tragedy, are not that huge. I mean, you have to think about it. The public health professionals prepare for about 36,000 flu deaths in the U.S. every year. So, I mean, a lot of people do die of disease just in general. These numbers are not that high at this point, and I would agree with the Frieden assessment, but I would add the words "at this point." I think we have to continue to monitor this and track this and make sure it doesn't get out of control.
Well, Tevi, at this point, as we know, 2 Americans who are doing missionary work, medical missionary work for Samaritan's Purse back in the United States at Emory in Atlanta. What's the latest update on those 2 Americans? How are they doing?
Well, I heard Dr. Brantley was doing okay. He actually came in ambulatory, meaning he was able to walk on his own accord. And they're taking this experimental serum, I believe it's called XMAP, that has not yet been FDA approved. I've seen some back and forth about why these 2 guys get it and the people in Africa don't get it. Depending on whether it works or not, it may be a great thing to have or may not be. So we'll see how that develops. But again, Ebola is something that's manageable when you have an advanced health system like we do. And so I'm optimistic about these 2 people. I mean, the death rates are quite high, and so it is a scary disease. But thus far, these 2 appear to be under control.
Tevi, one friendly amendment, I believe the experimental drug is called ZMAP. ZMAP. Get the letters right. Yeah. Let's see, you said X. I mispronounced it C. Right. Now it's ZMAP. So we'll both get it straight. And you touched on the public debate that's touched off. The 2 Americans receiving that, all the talk about FDA approval. Is this a situation where science can expedite regulation, or are we still going to have to see people jump through these bureaucratic hoops with this experimental drug?
Well, the FDA, unfortunately, is typically a pretty slow organization, and there was a great piece in the Wall Street Journal today by Scott Gottlieb and Colleen Klassmeyer about how FDA is trying to regulate apps on your smartphone that have something to do with medical technology if they monitor your health. So the FDA is always a very cautious organization, but it is in times of crisis that sometimes they let that caution go away a little bit, and they're a little more experimental or a little more edgy. And we saw this in the early 90s when HIV/AIDS was so out of control. They were a little more willing to look at experimental products. Now we have the cocktail that allows people to treat HIV and make it a livable condition. So I'm hopeful that we'll get to see a little experimentation get through the FDA as a result of this crisis, even though I wouldn't wish the crisis upon anyone.
Tevi, about a minute remains. Thorny issue, a lot of debate. Some health professionals and a lot of Americans are saying the 2 American missionaries should not be back in this country getting treatment. About 45 seconds. What's your take on that?
Yeah, look, I mean, these are Americans who are out there on the front lines trying to protect not only Americans but the world from diseases. And American public health workers really do wonderful work all over the world. For example, let me give you just one example. The CIA, our intelligence community, is very careful not to use public health people as cover. Not to say that any of their agents are public health people, because they want those public health people to be able to go out there to dangerous parts of the world, both politically dangerous but also medically dangerous, and try and be there on the front lines of the disease. And if we as a country say, we appreciate what you're doing, but don't come back while you have this disease, I think that would be somewhat callous. So with careful controls and given that this is not this is not an aerosol-borne disease, I think they made the right decision.
Bottom line, the Americans are back home. Tevi agrees with that. There's more to come.